Hi, I'm James Van Dyke, and I lecture at the Wodonga campus. In this video, I'm going to present medical imaging, how it works, and what it's used for. Medical imaging is a set of methods we can use to visualize the interior of a body with several aims. First, we can use it for clinical analysis, or to diagnose an injury or illness, like if you've had an x-ray to see if you've broken a bone. Second, we can use it to generally see the function of some tissues and organs. An example is using an ultrasound to check on the developmental progress of a baby. Basically, what we aim to do is look inside the body without having to cut it open. We're going to discuss three basic types of medical imaging. There are some other types that are used that we won't cover. First is X-rays. X-rays are a form of electromagnetic radiation with a very short wavelength. They can pass through most matter. You can think of them like a high-powered form of light. That's basically what X-rays are. Although X-rays pass through most materials, they're absorbed by denser materials like bone. Here we can use an X-ray generator to project X-rays through a sample or a patient to a detector on the other side. Whatever X-rays pass through without hitting anything dense turns black on the detector. Wherever the X-ray gets absorbed by a dense material like bone, they're blocked from hitting the detector, and that part of the image is then white. Here the bone appears white because it's absorbed those X-rays. Basically what we're seeing is a shadow in the X-ray beam that has been left by the bone. The small fracture you can see here leaves a small space for the X-rays to pass through, and so we can see it using an X-ray. X-rays are projections because the X-ray beam is literally projected through the sample or the patient to the receiving detector on the other side. The basic principle is exactly the same as a presentation projector in a classroom or a movie projector. This means if we want to visualize a different angle of the sample, we have to reorient the projector and the detector. Different projections are defined by the orientation of the body segment relative to the beam and the detector. I'm going to show here images of different projections. First is antero-posterior projection. Here the X-ray is projected through the sample from front to back, or anterior to posterior. Next is lateral projection. This is when the X-ray is projected through the sample from the side. Next we have postero-anterior projection. Here the X-ray is being projected through the sample from back to front, or posterior to anterior. And lastly we have axial projection, and this is where the X-ray is projected down the superior to inferior axis. A minimum of 2 perpendicular projections are typically needed to be sure that there's no injury or abnormality present in an X-ray. Here the lateral projection of the wrist on the left faintly shows evidence of a fracture in the radius, but the image is also partially obscured by the ulna. If you relied on this image alone, then you wouldn't have a full idea of what was wrong. The dorsal projection on the right shows the fracture in the radius much more clearly. Divergence is a basic principle of projection. X-rays will diverge from their source projector, here labeled S, like the light from any other source. You can demonstrate this yourself using a hand torch. But divergence also has consequences for medical imaging. If a body segment is close to the projector like this, then it will be magnified on the detector and the image will be less sharp and more fuzzy. On the other hand, if we move the segment closer to the detector like this, then the image we will see will not be magnified and will appear much sharper. This is why during most X-rays, the body segment being imaged is placed directly against the detector rather than close to the source. It just gives a sharper, cleaner image, which is important when looking for any injuries or abnormalities. X-rays are useful because they provide excellent imagery of dense tissues like bone. They're also useful for detecting abnormally dense tissues like tumors or lung damage from tuberculosis. They're also inexpensive once you've got the equipment installed. The major downside is that X-rays are a form of ionizing radiation and can cause DNA damage. This can lead to cancer and other health risks. This is why you're often given a lead blanket at the dentist's office. The risk means that patients can't be exposed to X-rays repeatedly. Every exposure increases the risk of a side effect. The other downside is that X-rays are no good for imaging soft tissues. So what are some alternatives to X-rays? One alternative is the ultrasound. Ultrasounds use a transducer to project a high-frequency sound wave through the sample. Here we can see the transducer being used to image the carotid artery of this patient. The sound wave passes through most tissues, but is reflected back to the transducer based on density. The denser the tissue, the more sound is reflected back, and the whiter the image. Ultrasounds are really good because they can image a range of tissues of varying densities simultaneously, from soft tissues to bone. They're also very portable, and they're relatively inexpensive. Most of all, they're harmless, and they're safe enough to use repeatedly on humans, even on fetuses. The main negatives are that the image resolution is not very good. Image artifacts are common, and it takes a lot of experience to get really good, crisp images. The other downside is that the sound wave cannot penetrate completely through the body, so not all structures are visible at a single angle. The probe has to be moved around quite a bit to get a really good series of images. The third type of medical imaging we will discuss is the MRI, or magnetic resonance imaging. MRIs use powerful magnetic fields to resonate hydrogen atoms. The hydrogen atoms then emit a regular frequency, which is collected by a receiver, and that turns the reception into an image. In the image, tissues are distinguished based on their hydrogen content. The more hydrogen or water is present, the whiter the image. The less hydrogen or water is present, the darker the image. Here in the MRI scan of the head, you can see that the vitreous humors of the eyes are very white, and that's because they have very high hydrogen and water content. You can also see all of the soft neural tissues associated with the brain, muscles, skin, and connective tissues present. The skull itself, the densest material, is completely absent, and so the MRI doesn't actually detect dense tissues like bone. MRIs are useful because they provide excellent imagery of soft tissues and do not detect bone at all. This makes them great for detecting soft tissue injuries and abnormalities. They also don't have any ionizing radiation, so they can be used repeatedly without any risk to a patient. They do have a few downsides though. The equipment is expensive, bulky, and noisy, and it can be claustrophobic for some patients. Patients also have to remain very still for long periods, sometimes more than an hour. Finally, the magnetic fields interact with metals, which can distort the image. The metal interaction can also be dangerous for patients who have pacemakers or metal implants, and generally patients are encouraged to remove any metal objects that might be present before they undergo an MRI. So I hope you've enjoyed this brief chat about medical imaging.